Marking World Diabetes Day, the government has been urged to strategize and reduce the cost of treatment for the disease that is causing 20% of deaths in the country. According to data from the Health Ministry, Violet Auma talked to Joan Abura, who has lived with diabetes for over 10 years and had her right leg amputated due to the effects of the disease. Listen in.
Unfortunately, when I could go to hospital, they could only concentrate on high blood pressure. And the pain was just too much.
58-year-old Joan Abura, and a mother of two, is one among many Kenyans suffering from diabetes.
And
she was diagnosed with the disease 11 years ago. She says she lived a normal life until 2012 when her life took a different turn.
They took my blood sugar, and the sugars were reading 28.
She was devastated after the doctor informed her that she was diabetic and her condition was on a critical level.
It has affected my sight. I don't see very well. It has affected my limbs. When I step on anything, I can't be able to know that I'm stepping on anything that can prick me. Diabetes has affected even my teeth. That is why I don't have teeth.
Although she had begun treatment for the disease, in 2018 she suffered a mild stroke. Her condition worsened in 2019 and she was told amputating her right leg was the only guarantee of saving her life.
I woke up one morning and I found my right leg was very heavy, and when I looked at it, it was swollen as well. After 3 days, all the toes on the right leg were already rotten. I was put in the farthest corner of the ward because I was stinking. The other patients couldn't withstand that smell. So every doctor who could come beside my bed told me there is no other solution other you being amputated.
The surgery took about 7 hours.
But the experience in the ICU is terrible. I couldn't even tell where I was. I was in great pain.
She's grateful to God for giving her a second chance in life. She says there is need for everyone to test for sugar levels regularly.
Sweet things, that's what I really loved eating, which I think contributed very much. And then secondly, I never took seriously something like having the body exercises. Anybody can be diabetic. We should all take care of what we eat.
Experts say type 1 diabetes develops when the cells of the pancreas stop producing insulin. On the other hand, type 2 diabetes develops when the pancreas does not make enough insulin and the insulin that is made does not work well as it should, also known as insulin resistance. Without insulin, glucose cannot enter the cells of the muscles for energy. Instead, glucose rises in the blood, causing a person to become extremely unwell. Insulin is a hormone our body makes to keep our body glucose levels within the normal range.
60% or more of our admissions in the hospital, many of them is because of diabetes or hypertension and their complications. So it's really a major concern.
Experts say the disease can be prevented through regular exercise and observing diet with less starch.
This is lifestyle diseases. It's very common in people who don't do a lot of exercise, people who are living sedentary life. 60% of the management of diabetes is based on the diet, the food portions, where we stress on the fact that you need to eat very little starch, and that's why they're saying kula ugali ngumi moja.
Symptoms of the disease include being thirsty frequently, urinating frequently, frequent hunger, weight loss, fatigue, blurred vision, among other symptoms.
It's like the 4,000 patients that are already enrolled here and about 120 children who are coming for the clinics here. That is only about 30%. 70% of the people are still out there and they're having this problem and they're not aware.
This disease has been making me blue. 12 years of cash problems.
This has seen some organizations like Safaricom partnering with government and private sector in prevention and management of non-communicable diseases to ensure early detection as well as creating awareness about the disease.
We're working with partners such as Kenya Diabetes Management and Information Center, DMI, to organize medical camps where early screening and diagnosis as well as medical care is carried out. I'm positive that this forum will enable us to come up with solutions that will lead us to our end goal, which is a healthy and a prosperous nation.
Safaricom Foundation has a 42 million shillings program in Garissa County of children with diabetes, where 737 children have benefited from free medication, including insulin and syringes.
In its own focus, Safaricom Foundation has chosen to look after early diagnosis and management of childhood diabetes, which is otherwise what we call type 1 diabetes, which is something that affects children and has no specific cause. It's not been very well understood in terms of the causative factors. And therefore, these children would normally die without a diagnosis. And what Safaricom Foundation is doing, and starting with Garissa County, is to work with the public sector and we work with other partners like the Diabetic Management Institute to ensure that a program is put in place for early diagnosis and treatment and care of children who live with childhood diabetes.
According to World Health Organization, the prevalence rate of diabetes in Kenya is at 3.3%, and by the year 2025, the number is likely to rise to at least 4.5%. World Health Organization says more than 425 million people worldwide have been affected by diabetes. Kenya was ranked by the International Diabetes Federation as the 31st country in terms of diabetes, with a prevalence of about 460 diabetic cases per 10,000 population.
When it comes to those deaths which are arising from non-communicable diseases, as we stand now, it's around 42.8%. And you can see now the deaths attributed to NCDs are rising. Okay? And diabetes is one of the cause of those conditions.
Dr. Akwabi says if left untreated, this condition can affect vital organs such as the heart, kidneys, eyes, ears, blood vessels, and sometimes may lead to stroke.
I have been looking for a prosthetic limb to replace my leg. It's quite expensive. 250,000, how many people can afford that?
Joan is now calling on the government to reduce the cost of treatment, which she says it's too expensive for ordinary Kenyans.
Since the corona pandemic came in, it has been difficult to even get those drugs. So if you are given 4 drugs, they will say we are able to get 1 for you, go and buy the rest. Diabetics is real, and I would say diabetes is one of the worst conditions, one of the worst diseases one may want to have.
Violet Auma, TV 47, Kakamega.